Hey guys, Dr. Cody Gordon here again. I'm going to give you a little bit of insight into some low back pain problems and where they come from for people. I've practiced for 20 years and I've treated a ton of low back issues. It's a very common complaint you can imagine that comes into the chiropractor's office. The low back pain is elusive to a lot of people. I'm going to show you why that is. We're at the drawing easel today because I'm going to do a little bit of an illustration. Check out what your low back should look like or what your spine should look like when we look at you from a side view. Let's have a look. Is facing this way. And we have three primary curves in the spine that I want to talk to you about. This is your cervical curve. This is called a lordotic curve, curving this way, front to back. About 30-degree curve is what we'd like, with the top over the bottom. That makes sense. The challenge that we have is we live in an environment that requires us to do a lot of forward leaning work. The position at the keyboard, shoveling the snow, forward leaning postures. And it causes this heavy head up here to drift forward. I'm going to show you what that posture starts to look like. Let's have another look. Okay, there you have it. This is what happens. The head begins to drift forward. As it does, it drags the curve out of the cervical spine. It's flattening and drifted forward. The mid-back becomes hyperkyphotic, leaning forward dramatically, quite a ways. And then we get into our low back. And look at what happens here is that curve flattens out completely. So the problem with that is that in your low back, between every vertebra in your spine, except for the top two, you have discs, cartilage discs that compress and absorb force, and they work really well at absorbing compressive forces. But if you take away that spring shape, you ramp up the force they have to withstand, and that becomes overwhelming to them, and they become inflamed and irritated. You can have a herniated disc or a bulge. All of that is happening without any damage being done primarily to the low back. Just this head forward positioning, because we're having trouble in the neck and the ability to hold our head back up over our head. So we need to correct that position. That's what I work on primarily in my office, correcting that position of the head on top of the neck to balance the posture. We get terrific results with low back patients almost without ever touching a low back. If I get that head back and I get those primary curves to exist or at least balance a heck of a lot more efficiently, the patient is going to get better because we've taken the stress off of the low back. Okay, if you're a low back pain sufferer and you've seen lots of people for low back relief and you've gotten nowhere, maybe try something that isn't focused on your low back. It might not be primarily the source of your problem. I hope this has been helpful to you. I hope it's been a little bit interesting and informative. I'll see you next time.